Dr. Durowade, can you tell us about the Sonata procedure?
Yes, of course. This is a procedure that allows doctors or gynecologists, I should say, to shrink fibroids for patients who have very heavy bleeding.
And what types of patients is Sonata appropriate for?
Great question. So patients who have fibroids, patients whose cause of heavy bleeding is fibroids, because heavy bleeding can be caused by other things. Let's say you come into the office, we talk about your periods are super heavy, and then I do an ultrasound and see a fibroid. Then we talk about treatment options, and this is one of the ones I've started offering my patients lately.
And what kind of symptom relief can I expect?
So less bleeding that you don't have to be going through pads every time you're on your period. Sometimes no bleeding at all.
And how soon can I go back to my normal activities?
Oh, you can go back the next day. This is what's cool about it. So you come in for the surgery, it takes maybe an hour to do, and then you go home the same day, you sleep out the anesthesia, you're back to work the next day. Well, you're back to normal the next day.
So there's no incisions?
Nothing on the belly, no incisions at all. We do it vaginally. This is the probe, what the probe looks like. We examine you, put the probe. So let's say this is the uterus. So we're basically putting the probe into and let's say the fibroid is in the uterus. Think of the uterus like it's a balloon. And so we put this probe inside the mouth of the balloon, see the fibroid, and then I have this little sticks here that allow me to deliver. That's my ultrasound probe that allows me to identify the fibroid on the ultrasound picture. And then I'm gonna push in, that's the needle that goes into the fibroid, right? So that it makes the probe stick and stay in the fibroid. I push in my prongs. Do you see how big those are? Those are the prongs that deliver the laser energy into the fibroid. So once that probe is in and we've confirmed that we're in a safe zone, then I press the foot pedal. Foot pedal delivers the laser energy, turns the fibroid from being as hard as a baseball to soft like a marshmallow, so that it doesn't have that volume, it doesn't have that strength, and it just kind of shrinks off. And so you're also stopping the blood supply, also reduces the effectiveness of the fibroid to cause heavy bleeding.
So if I want to learn more about Sonata and get a consultation, what do I do?
You can call me or text me at 708-340-1167 or book an appointment at dadurmedical.com. That's DARDUR medical.com.
Perfect. Thanks, Dr. Durowade.
Thank you.